My name is Kenneth Koval. I'm an orthopedic trauma surgeon at Memorial Hospital in Gulfport, Mississippi. I went to Tufts University for undergraduate and then NYU Medical School for my graduate training. I did an internship in surgery at Beth Israel Medical Center in New York and did an orthopedic residency at the Hospital for Joint Diseases in New York City. I've written over 300 articles and 15+ textbooks. Some of the important characteristics that I look for when evaluating a patient for surgery is the number of fracture fragments, where they're located, amounts of comminution, bone quality, and associated injuries that may affect my choice of implant. A plate can be used for any kind of fracture in the proximal humerus, unlike a nail, which are better suited for the simpler two-part fractures. A proximal humerus fracture I've used for two-part, three-part, four-part, as well as comminuted fracture dislocations. The medial calcard needs to be restored when fixing a surgical neck fracture of the proximal humerus. If the fracture is not comminuted, then you don't have to worry about it. Then you put the screws in whatever location that they want to go. If there is medial comminution, then you like to get a screw right along the medial neck, or if you want to, you could use that fibular allograft. My approach to the proximal humerus has changed over time. I was initially trained on the delto-pectoral approach, which is a workhorse approach to the proximal humerus, but there are some limitations with that approach. One is that it requires an extra person to hold back the deltoid muscle, and then it puts you more looking at the front of the proximal humerus as opposed to the side where the plate needs to be positioned. I've now switched almost entirely to a deltoid split approach. It gets you exactly where you need to be. The axillary nerve is easy to find. The plate will then be slid underneath the axillary nerve, and then you're looking at exactly where the plate needs to be positioned, and the fracture reduction is simpler through that method. All proximal humerus fractures basically have the same post-operative course unless there's a fracture dislocation. For the first, at the end of surgery, everybody goes into a sling. They can do pendulums as well as passive assisted range of motion for the first 6 weeks. At 6 weeks, I start them on active motion, and then at 12 weeks, they can start resistive exercises. The goal of surgery is to restore their function and get them moving. If you don't move the shoulder, it gets stiff. If the patient has a non-displaced fracture or minimally displaced, or they're not very active and they may be a nursing home resident, then I might treat them non-operatively and get them moving right away. But for the patient who is still active, who has a displaced fracture and is in pain, then I'll go with operative intervention. Well, I prefer diverging screw patterns because then it gives better fixation on the proximal humerus. If they all converge, then it's actually taking, the ends of the screws are taking up less real estate in the humeral head. If they diverge, then it gives you better fixation overall in the proximal humerus. So I prefer diverging screws. I've known a lot about the Polaris product for a long time, as the Polaris nail was, I believe, one of the first fixation devices for the proximal humerus that involved an intermedullary device. But the proximal humerus plate I've learned about through my reps as well as the company. I've used a lot of the Acumed products, and it was just a natural progression to try their proximal humerus plate. I like their locking screw, the 4.3mm locking screw, as well as the 3.5mm non-locker. I use a distal radius plate, their fibula nail, their ankle plating system, as well as the clavicle system. Companies right now are doing a lot of work, designing new products, education, coming into the OR, helping out with educating the surgical techs. It's certainly a joint process between the industry, the hospitals, the patients, and the physicians. I anticipate a long, fruitful relationship between all of us.